Women in Alabama are more likely to die from cervical cancer than women in most other states. January is Cervical Cancer Awareness Month. News 19's Emily Forrester spoke with a doctor from Huntsville Hospital about what women need to know.
I'm joined now by Dr. Gabrielle Hawkins, who specializes in gynecologic oncology at Huntsville Hospital. Dr. Hawkins, thank you so much for being here.
Thank you so much for having me.
So let's start by talking about cervical cancer. How impactful is it in our area?
So cervical cancer first is a cancer that starts in the cervix, which is the tissue that's right at the opening of the uterus. And so those cancers can develop in women with a cervix, and it doesn't discriminate as a cancer, so it can affect all races, women of different socioeconomic statuses, education status as well.
Doctors say there are 5 sneaky signs of cervical cancer. What are those? What should women be on the lookout for?
Yeah, so the primary symptom is bleeding. So abnormal bleeding, that is vaginal bleeding, so between periods, after intercourse, that's unusual, or bleeding that starts after menopause. Those are all things that should have you seek evaluation. You can also have abnormal vaginal discharge, sometimes pelvic pain or pelvic discomfort. And then at later stages of cervical cancer, you can also have some difficulty with urinating or even having bowel movements.
And what should women do if they see these signs?
So first thing is to call your doctor or whomever your primary provider is and try to get in to see them for an evaluation of your symptoms and also a clinical examination. If you have a gynecologic provider who does pelvic exams, seeing that person, or if it's your family medicine provider or your primary care doctor who does pelvic exams, seeing that person as well.
And this cancer can be preventable. Can you tell me what steps women can take to prevent this?
Absolutely. So one of the things that we can all do is make sure that children receive the HPV vaccine. The goal of vaccination is to receive that prior to to encountering the HPV virus, and that is acquired through sexual intercourse. And so vaccinating before having any type of receipt of that virus through intercourse. And then the vaccine is actually available up through age 45. So even if people were not vaccinated as children, they could qualify up to age 45. And the strains of the virus in that vaccine cover about 90% of the cancers that cause cervical cancer. So vaccination is really important. It's also really important to have annual pelvic exams where someone is looking at the cervical tissue to make sure it looks normal and referring for any abnormalities that are seen, and then pap smear screening, which the guidelines are well published, and you have to talk to your specific provider about, based on your history, how often you should have that screening done, but making sure you're having pap screening as well.
As you guys say, early detection can save lives, correct?
Absolutely.
And if you have any questions, we've got a link to all this information Dr. Hawkins talked about in this story on WHNT.com.